Good evening, doctors. On behalf of Hetero Healthcare, I, Dr. Prashant, welcome you to this webinar on recent perspective of Lasmiditan, new acute treatment for migraine. Doctors, as you know, at Hetero, we market products in multiple therapy areas like in dermatology, gynecology, orthopedics, pulmonology, and neurology. We have very strong R&D support, and we have developed many unique formulations, ultimately keeping patient benefit in mind. Our endeavor is to develop products and formulations which will improve patient compliance and ultimately clinical outcome. We have developed some unique patches, NSAID patches, rivastigmine patches to improve patient compliance. Today's webinar, doctors, focuses on migraine treatment. Migraine, we know, is a condition with severe headache, nausea, photophobia, phonophobia, etc. It's a very acute condition requiring immediate treatment and immediate relief. To speak more about migraine and use of role of lasmiditan, today we have with us very eminent doctors. The chairperson of today's meeting, Dr. Dr. A V Srinivasan. Sir is Emeritus Professor, Dr. MGR Medical University, former head and professor of neurology, Institute of Madras Medical College, former president of Indian Academy of Neurology. Dr. Srinivasan has more than 100 papers and presentations. He has spent 50 golden years in Madras Medical College as a student, faculty, professor, and as emeritus professor. Sir has written 40 books, both in regional language as well as in English, has received 10 Lifetime Achievement Awards. 5 neurologists have obtained PhD in this country under the guideship of Dr. A V Srinivasan. Welcome, sir. Welcome, Dr. Srinivasan, to this meeting.
Thank you very much.
The speaker for today's evening session, Dr. Shankar Balakrishnan. Dr. Shankar Balakrishnan is Head of Department of Interventional Neurology and Neuromodulation and Rehabilitation. Sir has 28 publications to his credit. Sir, the area of specialization of Dr. Shankar Balakrishnan is gait lab and mobility clinic developments for Parkinson's disease, spectral analysis and biomarker research in Parkinson's disease, restorative surgery and rehabilitation techniques for paralyzed arms. Dr. Shankar has received prestigious Professor CUV Gold Medal for all-rounder Best Outgoing of the Year in DM Neurology 2015. Most Admired and Innovative Neurologist of the Year 2022 by the Iconic Healthcare Summit and Awards 2022 by India Today and Outlook. With this brief introduction, I welcome both the speakers and the chairperson and hand over the session to you. Over to you, sir, for further deliberations. Thank you.
Thank you. Thank you, Dr. Prashant. Yes, Dr. Bal, we are just eagerly looking forward to your excellent talk once again, because it's going to be certainly really a thought-bearing one and a very practical one. Over to you, Dr. Shankar. We are just going to listen to your best.
Thank you, sir. Thank you so much. All your blessings.
Yeah.
So, thanks for this opportunity. It is always a blessing to talk in front of Professor AVS, sir, my mentor, who's helping in all critical times and time in need. He comes and his blessings is always there with us. And to start with, today we are going to see about Lasmiditan, the efficacy and safety for acute treatment of migraine. So migraine is, we all know the incidence. If we talk about the incidence, even we did a small pilot study in the hospital, because in the hospital, like corporate setups, people are doing like day and night shifts. Their sleep is compromised. Sometimes they have to do the night and then wake up in the morning and have to come for the work. So we did a small pilot study to find out the incidence of migraine among the doctors. So the incidence is so high, like every three doctors, if we pick up 5, 3 out of 5 had migraine in their career, and some, like, mostly it's related to the professions who are dealing with patients in the, like, with sleep disturbance and with sedentary lifestyles, and it's a lifestyle disorder. So even among the doctors, the incidence is so high. When you look at the general public, the migraine incidence is too high. So we need to address this issue, and we have been treating with different medications. And when you look at the disability and the burden, it is definitely a significant burden to the disease. And there are a lot of limitations in the current acute migraine treatments. The traditional drugs like non-steroidal anti-inflammatory drugs or trends, still we are asking them to limit the usages and then to get away with prophylaxis and lifestyle modification. But still, the patient's needs and termination. They don't nobody wants to suffer with acute headache, so they want to stop it. And sometimes the overuse of acute medications leads to chronicity of the disease also. There are a lot of unmet needs in migraine therapy. What is important is they need a fast onset of action and improved efficacy of the pain. They want to be free of pain within 2 hours, better tolerability, and of course, the safety profile is very, very important for them. An effective treatment of patients with contraindications to current therapy, we need a solution. And solution for refractory or chronic migraine patients is still under. So this is the survey we did, like what they want in acute migraine. So out of like 87% prioritize elimination of pain. They don't want pain. That's the first. And of course, 83 prioritize they want a rapid onset of relief. So among the doctors, these are the two important like responses. What you expect in acute migraine therapy? So they want something rapid, and then it should go off. It should not continue. They want to get rid of it. So a novel approach to acute migraine treatment is Lasmiditan. Here, what we are going to see is the mechanism of action. So this drug is classified as ditans. They targeted towards 5-HT1F receptors, and there are multiple ways. Here, we need to look at how there is multiple ways of acting it. The most important property of this molecule is it lipophilic. So it is so much attracted towards lipids. So hence it's easy to cross the blood-brain barrier and then acts on. It reduces the plasma protein extravasation as well as reduces C-phos expression and inhibits CGRP release also. So this is the most fascinating thing. And if you talk about a new drug or how does lasmiditan treat the migraine, these are the questions that comes to our mind. How effective it is, and does it have any potential side effects, and what are the doses available, and how do you obtain the access for it? So lasmiditan is the novel approach to acute migraine treatment. Oral bioavailability is about 40%, can be taken with food or without food, and they reach the peak plasma concentration is reached in 1.8 hours with onset in 30 to 60 minutes, and metabolized by non-CYP enzyme individuals. Hence, the chances of drug interactions is very, very less, and it's excreted in the urine. So when you look at the mechanism of action, it's agonist for 5-HT1 receptor on the neural synapses. It crosses the blood-brain barrier, and also it acts on the peripheral nervous system, which is a unique property of this drug, especially the trigeminal vascular systems. It acts at the receptor level. So the main structures is meninges, the cortex, thalamus, hypothalamus, and of course the trigeminal neurovascular system. It inhibits glutamate release and thereby induced the C-phos expression is reduced. Nociceptive dual evoked neural activation, dural plasma protein extravasation is reduced, as well as CGRP release is inhibited. So all these leads to termination of pain. So the pain propagation both in the central nervous system and the peripheral nervous system is inhibited. The clinical significance. So it is a rapidly elevating migraine symptoms. It brings the headache under control, and also symptoms like nausea and photophobia and phonophobia. And typically it reaches 30 to 60 minutes. It provides a faster relief, and it's approved by FDA in 2019 for treatment of migraine in adults. So to summarize the actions, it inhibits the 5-HT1F receptor by pain pathway, as well as it inhibits the release of neurotransmitters and neuropeptides. So when we look at a new molecule, what are the phases, the trials they have done, and what are the findings that they came out? So in phase 2 trials, dose finding and proof of concept studies, the dosage, various dosage like 50, 100, 200, 400, And what we are looking at the endpoint is the headache response at 2 hours, and significance efficacy was achieved at 100 to 104 milligram doses. Also, when you look at the unique property of acting on 5-HT1F receptors, unlike the triptans, they are targeting and they are attached to the receptors 5-HT1B and 1D. The main problem with triptans is these receptors are more expressed in the endothelial cells of the myocardial blood vessels. So hence the cardiovascular risk factor is a significant concern with triptans, whereas dietans, they have a high selective affinity towards 5-HT1 receptors, and hence the chances of cardiovascular events is very less with the dietants. The safety and tolerability, when we look at the phase 2 studies, there is no adverse side effects were reported in phase 2. The most adverse effects were classified as mild to moderate in intensity. There were no clinical significant effect on the blood pressure or the heart rate were observed. Unlike triptans, there is no vasoconstrictive effect was noted. So when we look at the safety and tolerability across phase 2 studies, despite CNS side effects, most patients tolerated the drug very well. Dropout rate were due to adverse events were very low, and most adverse events were transient, which resolved within 24 hours. So this indicates the safety of using the drug. And when we look at the Samurai, Spartan, and Gladiator, these are the trials to assess the efficacy, safety, and tolerability of Lasmiditan. In Samurai study, the difference between Samurai and Spartan is the Spartan took or they classified the patients, they included and randomized patients with cardiovascular events. So all the cardiovascular events were considered in Spartan, whereas Samurai is in both together. They analyzed around 4,000 patients, but in Samurai, it's a double-blinded studies, and when randomized, they could show good benefits with 200 and in 100 when compared to the placebo. And then Samurai studies, higher proportion of patients achieve the pain relief at 2 hours when compared to placebo. So what is MBS, most bothersome symptom relief? As a most bothersome symptoms relief is significantly achieved in high proportions. They experience pain-free freedom within 2 hours, and 40% for 50 milligram, and 44.2% for 100 milligram, and 48.7 for 200 milligrams versus 33 for placebo. The common side effects is dizziness, fatigue, and paresthesia. When you talk about paresthesia, it involves perioral paresthesia, and they were able to overcome in 24 hours. So clinical evidence supporting Lasmiditan is the Spartan trial, where it's also a double-blinded trial. 2,126 adults with history of migraine with 50, 100, and 200 milligram versus placebo was achieved. Significant headache was relieved in 2 hours after starting the treatment. The Spartan summarized the most bothersome symptom relief is achieved the same way pattern as 2 hours in 40% and 44.5 for 100 milligram and 48% with 200 milligrams versus the placebo. In summary, also the same side effects like dizziness, fatigue, and paresthesia was observed. So Gladiator trial, it's a long-term, it's used to assess the long-term safety and efficacy. This is also a randomized trial. Here, it's predominantly to assess the safety as a primary objective. As well, here the efficacy was the second objective. 100 and 200 milligram for acute migraine attacks up to 1 year studies, and then who enrolled who had completed the previous single attack Lasmiditan and were randomized, and safety were assessed throughout the study, and they used MIDA scoring to assess the severity. So what Gladiator trial showed is safety of these patients more than who received more than 1 dose of Lasmiditan were included. The most common treatment emergent adverse effects like dizziness, somnolence, and paresthesia were all less than 20%. The frequency is also decreased generally with substitution attacks. No treatment-related serious adverse effects were noted, and most important is no cardiovascular effects like or vasoconstrictions is noted with the Lasmiditan, and only 12.8% discontinued due to adverse effects. So when we talk about the efficacy in this study, the pain freedom is 26% for 100, and the most bothersome symptom relief is achieved for 37.5, and pain relief in 54.58%. It's consistent, and MIDA scores totally decreases over a period of time. So what this trial concludes is showed intermittent lasmiditan either 100 and 200 is well tolerated and more efficacious in treating acute migraine treatment over 1 year period. So the post hoc analysis or the post marketing survey analysis data continue to support the efficacy as well as the safety profile of data. Real world evidence from patients and healthcare provider feedbacks is also considered. And for efficacy in real world data aligns with the clinical trial, finding it much effective in relieving migraine within 2 hours of administration. And safety profile is also good, and no major adverse effects were noted. How does the superiority of lasmiditan over other available drugs is the unique mechanism of action. This high affinity for 5-HT1F receptor agonists, unlike the triptans, which targets both 1B and 1D receptor, leads to vasoconstriction, whereas lasmiditan specifically activates 1F receptors. This mechanism does not cause vasoconstriction, hence makes it beneficial for patients with cardiovascular risk factors, making it more safer and for a wide range of patients. So also when you look at the safety profile, cardiovascular safety, non-vasoconstrictive action, reduce the risk of cardiovascular side effects such as hypertension, heart attack, stroke, which are commonly associated with triptans. Mild side effects such as dizziness, fatigue, and paresthesia are well tolerated, and most of them are transiently relieved. And when we talk about the pain relief, superiority over rapid pain relief, and superiority in relieving most bothersome symptom. Both the Samurai and the Spartan showed that they are very effective in reducing the pain within 2 hours of administering the dose. The quick onset of action is effective if it is not better than whether other drugs takes more time to get a pain relief. So when you look at most bothersome symptoms, lasmiditan effectively reduces nausea, photophobia, as well as phonophobia. So when we look at medication overuse headaches, so lasmiditan has a lower likelihood of causing medication overuse headaches when compared to acute treatments. Here, in trials, what they compared is there's a phenomenon called drug liking. Drug liking means if you are taking benzodiazepines, you become a drug liking, you continue to take and you cannot get rid of it. So it's called drug liking phenomena. So when compared to those drugs, the dependency and overusing of lasmiditan is very less, and the tendency to overuse is also less when compared to triptans. And improved patient outcomes means the quality of life is better when compared to other medications, as well as flexibility in patient population selections. So broader patient suitability. So lasmiditan is used across wide range of patients, including those who cannot take triptans due to cardiovascular risk, and those who do not respond to the traditional treatments also showed good response, enabling it to use across a diverse migraine patient populations. So the key findings from Centurion studies is it's effective, safe for patients who do not respond to adequately to triptans. So when triptans fails, what to do next is a question among the neurologists. So 43% of overall safety populations where triptan insufficient response were called as TIR. Majority classified based on triptan efficacy alone. And inclusion criteria is moderate migraine-related disability with a MIDA score of more than 11. And with triptan insufficient responders group and higher MIDA score when compared to triptan naive or sufficient responders. So most patients who are refractory to triptans, they cross different populations from Europe and Asia, where different patterns were used. And here, lasmiditan is in acute migraines is not efficacious but influenced by excluding the patients based on tolerability issues and contraindications. In phase 3 trials, assessing the efficacy and consistency of lasmiditan across 4 migraine attacks groups, over 1,470 patients were randomized and used dosage 200 and 100 versus the control group. The control group received placebo for 3 attacks and lasmiditan 50 for 1 attack. So the endpoint is pain freedom at 2 hours, the first dose, first attack, and pain-free freedom at 2 hours in at least 2 or 3 attacks. When you look at it at 2 hours, and lasmiditan 200 milligrams is able to achieve 30%, 100 milligram is able to 25%, and placebo is 8.4. And pain relief at 2 hours, like 200 milligrams 65%, and 100 milligrams is 65%, whereas the placebo is 40%. So when you look at FASC, consistency of the response, the pain freedom in more than 2 of the 3 attacks, lasmiditan is able to achieve 25% with 200 and 14% with 100 milligram. And pain relief in more than 2 of the 3 attacks with 200 milligram is 66% and lasmiditan 62.3% versus the placebo is 36%. So the secondary endpoint. So early onset of effect at 1 hour with significant for both the doses is achieved. Sustained pain relief at 24 and 48 hours for both the doses is achieved. Significant improvement in MIDA score is also achieved. So so those who demonstrated insufficient response to triptans also responded very well to lasmiditan. And when we do an arm-to-arm comparison, lasmiditan versus triptans, looking at the mechanism of action, it's very, very selective and non-vasoconstrictive when compared to triptans. And safety-wise, lower cardiovascular risk with lasmiditan. And FACs, when compared to it, even those who are not responding, we can use ditans. And offers additional is most bothersome symptoms, including photophobia, phonophobia, and nausea, is also relieved by lasmiditan. When compared lasmiditan versus non-steroidal anti-inflammatory drugs, lasmiditan is a targeted migraine drug, whereas NSAIDs provide generalized pain relief. Lasmiditan avoids gastrointestinal and renal side effects, which is very common with NSAIDs. And when you compare a specific relief for migraine symptoms, whereas NSAIDs may not address all the symptoms effectively. And when we compare lasmiditan with ergots, its selectivity makes it superior over ergots non-selective, which is very, very non-selective. And safety profile is very better with lasmiditan with fewer side effect profile. And lasmiditan provides targeted relief with few risk of prolonging vasoconstrictions when seen with. So to conclude, lasmiditan offers significant advantage over other available drugs for migraine treatment, and its unique mechanism of action make it superior safety-wise, rapid onset, and suitable for wide patients with migraine, and those particularly with cardiovascular risk and those who are not responding to other modality. Lasmiditan is proven effective and safer options when compared in managing acute migraine attacks. So here is few case studies. Here, 45-year-old female with cardiovascular risk, with a in the background of hypertension, high cholesterol, family history of cardiovascular disease, having migraine for more than 20 years, typically 3 to 4 attacks per month. Previously, she was taking triptan, which is ineffective and contraindicated due to cardiovascular risk. NSAIDs partial relief was there, and preventive medications showed limited success. When started on lasmiditan, so severe migraine attacks with thrombing headache, nausea, photophobia. Given the cardiovascular, so we have neurologists prescribe lasmiditan for acute treatment options. The patient takes lasmiditan at the onset of migraine. She reports significant pain relief within 2 hours and marked reduction in nausea and photophobia. So the safety is mild dizziness, but no serious side effects, and there are no cardiovascular concerns for her. The patient is satisfied with rapid relief and absence of serious side effects and improved quality of life. Here is a male with frequent migraines, 30-year-old male, healthy, no significant cardiovascular risk factors. Whether migraine is episodic, 6 to 8 attacks per month, often triggered by stress and lack of sleep. And previously, there was over-the-counter pain relievers, which are ineffective, and triptans moderate but relief, but unpleasant side effects were noted. The patient seeks more effective treatment for his frequent migraines, so neurologist prescribes lasmiditan. And here the patient takes lasmiditan during migraine attack and reports substantial pain relief within 1 hour. They also experience less nausea and light sensitivity, experience mild fatigue and dizziness, but finds these side effects are manageable. The patient appreciates the rapid onset of action and ability to continue daily activities with minimal disruption. And in case 3, a 50-year-old female with migraine and depression. So 50-year-old female with a history of depression managed with SSRI, chronic migraines, and migraine for 25 years, 2 to 3 attacks per month, associated with hormonal changes. Triptans are effective, but concerns about interaction with SSRI and preventive medications have limited success, and the patient experiences severe migraine that disrupts her daily life and mental health. Concerns about triptan SSRI interaction, and neurologist prescribed lasmiditan. He takes lasmiditan at the onset of migraine and reports significant relief within 2 hours with reduced headache and intensity and associated symptom, mild dizziness, which is a primary side effects, but no serious interactions with her SSRIs. Patient finds lasmiditan to be safer alternative to triptans, alleviating her concerns about drug interactions and improving her overall well-being. To summarize, lasmiditan demonstrate rapid, significant relief of migraine symptom, including headache, nausea, photo and phonophobia within 30 to 60 minutes of administration. The clinical trials, including phase 2 and phase 3, as well as post-marketing surveillance, indicates a favorable safety profile, with most adverse events being mild to moderate and transient, and no significant cardiovascular effect noted. So the primary patient's outcomes provides effective treatment for patients who do not respond or cannot take triptans, expanding the therapeutic options. Quality of life is more manageable, like symptoms of management, and minimal side effects makes it improves the quality of life. And lasmiditan offers a promising alternative for acute migraine treatment, particularly for patients with cardiovascular concerns or contraindications to other therapies. Thank you.
Thank you, Dr. Shankar. Thank you very much for your presentation. Lovely insights. We are very clear. Doctor, there are a few questions on this.
Yeah.
Yeah. One is, someone has asked if pain relief is inadequate after first dose, after say 4 hours or so, then what do we do? How do we add something?
Yes. So the recommendation is if we take the first dose, so taking the second dose of Ditans, that's a concern among even the neurologists. So when you look at those studies, there is a graph pattern where they showed the benefits when you take it over a period of time. Those who doesn't respond well also will respond over a period of time.
Okay.
So that's what in the graph that we saw.
Okay. And suppose if someone gets an attack, say very next day, he can very well take it, is it?
Yes. The way after 24 hours, they can very well take it.
Yeah, but one thing, doctor, one thing you must take into consideration. The 10 tablets you cannot, only in 1 month you can take 10 tablets alone.
10 tablets?
You should be careful. Yeah, only 10 tablets.
Okay.
And that too, you use it very frequently. As he rightly pointed out, the efficacy, of course, does come when you cross. But only thing is, above 65 years of age.
Correct.
One interesting thing is, please use only 50 milligram and not 100 milligram to start with.
Okay.
That's a point of interest in including the first drug.
Yes.
The second point, of course, is very, very important to note that you have to use only very much between 10 tablets, not more than that. I think that is going to be a very useful clinical point for people who are practicing.
In fact, it's documented that not more than 4 also in many of the patients.
And not more than 4 continuously and 10 in a monthly basis.
Yes, correct. Now, when we compared it with triptans, we saw that it scores in terms of safety, basically in terms of cardiovascular safety. Doctors, what is triptan's effect on those other symptoms like phonophobia, photophobia, or vomiting? Do triptan work there?
So when you choose the triptans, the most annoying symptoms is the chest discomfort they get.
Yeah, correct. Especially angina patients, so that they cannot take it.
Angina patients. So when you look at the concerns with photo and phonophobia, of course, triptan doesn't address that issues.
Correct. That's a big advantage.
That's a big advantage of it. And when we ask about, some patients have a preceding aura and a post aura also. So those who experience aura throughout, so they need to restrict themselves from getting into the work. So because of considering this photophobia and phonophobia.
Correct.
So even while working in workplace also, they cannot avoid. So they can't go to a dark room. So in that aspect, lasmiditan gives a benefit of addressing.
Absolutely. So it would especially score over triptans in patients with aura,
Yeah.
migraine patients with aura. Correct. And so the place with therapy, I mean, you have given a very clear-cut answer. Those patients with migraine with aura, this drug should be preferred because it will take care of aura symptoms also, include and other photophobia. Any incidence of tolerance or rebound headache, especially on prolonged use, as the sir has said, more than 4 tablets or more than 5 tablets. Any incidence you have experience of tolerance? I feel it's too early to say really, because the product is available just 4 5. I mean,
Any receptors, when we do the medications against the receptors, we need to look at the affinity of the receptors towards the molecule, and that's what we need to wait for some time. So when the treatment comes, so while we are shifting from triptans, they become non-responder. And
absolutely.
when we do it overdose medication, also like triptan-induced headaches were there.
Yeah.
We need to wait some time to know about the tolerance, dependency,
Correct.
overuse.
But that
trial
is
shows that overuse is very less with lasmiditan.
absolutely, because you are using only 1 tablet that way. Yeah. And the new drugs in migraine, I mean, the research is going on currently in this direction, Ditans only.
Yes, I showed a picture which shows a lot of molecules where they are trying with the same receptor, one F. So in future, we will be coming up with multiple drugs and look at the benefits. We are all the drugs were focused on the central nervous system, but Lasmiditan showed a way that it can act on the peripheral nervous system also. So the perspective will change, and more
Yes,
new
newer drugs.
and second generation, third generation.
But one interesting facet of this particular
Yes,
point
Yes,
is
sir.
the G-pant is coming into Titans.
Correct.
No, I thought the G-pant is outside the brain,
Correct.
whereas Titans is inside the brain.
Yeah.
And all the 3 drugs now has been analyzed, and they are not going to do a one-to-one comparison study.
Yeah.
But one fact is still the Titans is like a Titans.
Yeah.
It's a very good drug that has come into play.
As of now, yes.
The second point,
Yeah.
you use 500 and 100 and 200.
Correct.
Now, when you don't get the good response in 100, people have suggested that you should go to 200, because I've had a patient who has been having a headache of 25 years. Seen almost all over the world, every other person, including India. And when she took this, she had a very good relief in the first 2 weeks. And after that, it once again came. I was just searching for that, but by and large, the headache really gave her a very good relief. The person who had 25 years with Titans. The dose started was 50, went to 100 in her, and then we went to 200. And this point must be given to the practicing person that please don't cross beyond 200, because beyond 200, the efficacy is not there.
And safety also concerns, we do not know what will happen.
And one point is immediate. I think it should be discussed among the patients. There is an increased incidence of especially dizziness. Hence, it should be advised that they should not drive the car for 6 hours.
6 hours,
Second, 6 hours. And second point is, when you are using these Titans, be sure and you are not using too much of the antidepressive drugs. One point that especially you must be aware of it. Other than that, I think this is a lovely drug for us.
The most common and most popular dose would be 100 milligrams, I suppose.
100. Excellent. That's the best.
Correct. And a very interesting point you said, a patient above 65, we should start with 50.
50.
That's very interesting. Thank you so much, sir. It was a pleasure and good insights. Migraine, we know, one has to suffer from migraine to know what migraine is. I mean, it's so bad. Thank you so much for your time, and thank you. Now, I will thank you thank you all the participants who took time from their busy schedule and commitments and attended this webinar. Thanks marketing team Hitro for conceptualizing and organizing this event. As you all will agree with me, this type of program requires excellent coordination from field. Thank you Hitro field personnel for a super coordination. Last but not the least, as for a seamless presentation, IT team does the best job, and thank you IT team Hitro for your support and guidance in all technology related matter. Thank you all once again, and signing off, wishing you a very pleasant evening. Thank you. Thank you, sir.
Thank you.
Thank you very much, Dr. Prashant and the group
Thank
of
you.
Hetero Healthcare for nicely organizing this particular thing. I'm delighted to join you all, and
Thank you, sir.
particularly for the lovely talk that Dr. Shankar gave.
Yes, Dr. Shankar, thank you very much.
Thank you.
Thank you.
Thank
you very
sir.
much.
Thank
Thank
you.
you.
Yes, sir.
Thank you so much.